Good afternoon, everyone. Thank you for joining us. It is my pleasure to have this to meet with Stacy today and have this presentation for you. We are Cancer Support Community Delaware. If this is your first time doing a program with us, welcome. Our mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community. And we do that by offering support groups, healthy lifestyle classes, and also educational sessions like this one. We do all of it at no cost to all our participants. A few housekeeping things before we jump in. We just ask you to keep muted. I think everyone was muted as they were coming in, which is good, but it just is the best experience for everyone if you are muted. So thank you for that. We will have times when you can jump in, ask questions, maybe add something to what we're talking about, and feel free to unmute at that time. But just for most of it, let's do muted. And what else? Oh, you can use the chat at any time. So whether we're asking a question, you think of a question along the way, please do that. We are going to have question and answers at the end, as I think I mentioned. And I am recording. We will be sending you the recording. If you registered for today, you get the recording. I'll also send the presentation slides, so you'll have that as well. At the very last slide, you'll have my contact information. So if you think of something later, you want to come back to me, you can feel free to reach out to me, or you want to ask a side question that something made you think of, please feel free to reach out. One last thing before I introduce Stacy, we are going to have a small little interactive part where there's some writing. So if you don't have like pen or paper close by or something to write with, whether you could use your phone, however you want to do that, feel free to go grab something quickly before we get started. Um, so again, welcome to Sleep and Cancer. Our presenter today is Stacy DeLucchi. She was born and raised in New York and New Jersey and moved to Ohio to attend The Ohio State University, where she graduated with a Bachelor of Science in Science degree in psychology. She began working at the Ohio State University Medical Center on the inpatient psychiatric unit, where she discovered her love of nursing. She obtained her LPN, followed by her RN, then returned to school and got her BSN, followed by a Master of Science degree in nursing from Indiana Wesleyan University. Sorry, tongue twister, and you could tell she really did love nursing with all that. She is an ANCC board certified psychiatric mental health nurse practitioner dedicated to providing compassionate, evidence-based mental health care across the lifespan. She's worked in the field of psychiatry for the last 20 plus years in a variety of settings, including both inpatient and outpatient mental health treatment. She relocated to Delaware in 2024 and joined BayHealth in January of 2026. Her approach is centered on building genuine therapeutic relationships where patients feel heard, respected, and empowered to participate in their treatment. It is her privilege to support her patients during some of life's most challenging moments. Her goal is to help individuals build resilience, preserve hope, enhance quality of life, and find meaning throughout their cancer journey while ensuring they never have to face it alone. So you can see why she's a perfect match with Cancer Support Community Delaware with those qualifications. So with that, Stacy, I'm going to turn it over to you.
Hi, everyone, and thank
I'm sorry, Stacy, you are muted, and I apologize. I might have hit that myself.
That's okay. Can you hear me now?
Yep, we're good.
Okay, very good. I was just saying thank you all for being here and joining me today. And this is my first presentation with Cancer Support Community of Delaware, and I'm very excited to collaborate with Erica and the Cancer Support Community of Delaware in general. And so thank you so much for joining us. So we are talking about sleep, healthy sleep habits and things in that realm, especially while you're going through a cancer journey. So the overview of what we're going to be talking about today is the importance of sleep. After that, we'll talk about how cancer can impact sleep in different ways, also optimizing your sleep practices, and then how to talk with your healthcare team about sleep and if you are struggling in any kind of way and how to advocate for yourself. So the first part is the importance of sleep, just understanding why sleep is so important for your body and your mind. So sleep plays a vital role in good health and well-being. It attributes to having an improved mood, improved decision-making abilities and problem-solving skills, boosting immune system, lowering blood sugar, and having a better appetite. Getting enough quality sleep and at the right time to protect your mental health and physical health, as well as quality of life and safety. Sleep helps your brain function and work properly. And while you sleep, you're preparing for the next day, and your brain is forming new pathways to help you understand and retain information. This can be imperative in your cancer journey, as every time you go to an appointment, there's a lot of information being thrown at you from your care team. Sleep can help improve your overall mood and helps control emotions as well as behavior. It can help improve decision-making and problem-solving skills, as well as promoting learning. In terms of your physical health, sleep plays an important role in that. While your body is sleeping, it's healing and repairing itself. Sleep helps boost your immune response and lowers your blood sugar, as I mentioned, and it helps maintain a balance of healthy hormones, as well as supporting a better appetite. Sleep disturbance is extremely common in cancer patients. 30 to 75% of cancer patients have reported trouble sleeping in some capacity. This is 2 times the rate of the general population. 46% reported they were moderately to severely concerned with sleep problems, and 18% reported a worse quality of life related to sleep disturbances than the national average. Optimizing your sleep practices. Identifying sleep disturbances is going to be key. So if you are having trouble falling asleep, waking up several times in the middle of the night and remaining awake, having frequent and long naps during the day, difficulty concentrating, waking up too early in the morning, loud snoring, breathing, or gasping noises while you sleep, lack of sleep, or on the other side of that, too much sleep. These are all signs that a person may be experiencing a sleep disturbance. Lack of sleep and too much sleep can both be signs to watch depending on the person. And we always want to look for any kind of changes to your normal patterns. So whatever is typical for you is usually okay to continue as long as you're getting an adequate amount of sleep and rest per night. But overall, when we look at sleep disturbances, we want to know if what is happening is your typical self and has been for a long period of time. The importance of sleep and how cancer impacts sleep is also something to be aware of. So fatigue, irregular sleep-wake cycles, insomnia, and are the most common sleep disturbances found in cancer patients. Fatigue is overly feeling weak and more tired than usual, or feeling the need to rest and sleep more. Insomnia is having trouble getting to sleep or staying asleep. 31% of people reported insomnia. There was a 2011 review published in an oncology journal that estimated that 50% to 90% of cancer patients reported feeling fatigued at some point in time during their cancer journey. So how cancer impacts sleep. Your sleep can be impacted if you have treatment or medication side effects. Side effects of treatment or medicine, such as pain medicine, nausea, trouble breathing, needing to use the bathroom, etc. Something that you can do is ask your nurse or doctor for ways to combat symptoms so that you can get to sleep and stay asleep. You may be prescribed another medicine to help with side effects that can help encourage better sleep. Stress and thinking about your diagnosis may keep you awake at night. For stress, you can try deep breathing exercises, journaling before bed to get any worry out of your head, and make a list of things you can do to combat the worry, such as asking a friend for help or asking your doctor a clarifying question if something is looming. There are several cancer-related and physical symptoms unique to you that can affect your sleep. And the biggest thing is to talk to your healthcare team and advocate for yourself on what is going on with you, as it doesn't happen the same way for any two people. Treatment and medication side effects. Your sleep can be impacted if you have treatment or medication side effects, radiation therapy, chemotherapy, hormonal therapy, surgery, anemia, medications to treat pain or nausea. Cancer treatment in itself, sorry, Erica, I know I'm kind of bopping all over the place. Cancer treatment in itself, such as chemotherapy, radiation therapy, surgery, bone marrow transplantation, and biological therapy may all cause fatigue. You may experience fatigue when chemotherapy or radiation therapy destroys healthy cells in addition to the targeted cancer cells in your body. Anemia, you may develop anemia if your treatment destroys too many healthy red blood cells. You can also develop anemia if the cancer has spread to your bone marrow and interferes with blood cell production or causes you to lose too much blood. Also, other medications, such as pain medications, can cause fatigue, such as pain relievers. Hospital stays. The hospital environment and hospital routine can create sleep difficulties. If you have to stay in the hospital, your sleep may not be ideal. You may be disturbed by noise, medical equipment, hospital staff, and unfamiliar surroundings. Some tips for long hospital stays would be to bring some comforting items from home. Keep the blinds during the day and help maintain a regular sleep schedule. Ask for medication or treatment to be administered during the day, and follow good sleep habits and good sleep hygiene tips. Pain. There are many different reasons for pain that cancer patients experience. Pain from the cancer itself. It could be where the tumor is located, for example, spinal cord compression or bone pain. Surgical pain can last for a few days to a few weeks after surgery. Phantom pain, after removal of a body part, you may feel an unpleasant sensation in that area despite the fact that the body part is gone. Side effects from chemo and radiation, such as neuropathy, mouth sores, skin burns, or scarring. Pain may also wake you up in the middle of the night or prevent you from falling asleep in the first place. Talking to your doctor is very important in determining how to effectively manage your pain. Palliative or pain management options are usually available from the team you're working with, as well as integrated medicine options. Fatigue. Cancer-related fatigue is one of the most common side effects of cancer and its treatment. It usually comes on suddenly, is not a result of activity or exertion, and is not relieved by rest or sleep. Fatigue is less precise, less cause and effect. Fatigue is a daily lack of energy, an unusual or excessive whole body tiredness, which is not relieved by sleep. It can be acute, meaning lasting a month or less, or it can be more chronic, lasting from 1 to 6 months or even longer. Fatigue can have a profound negative impact on a person's ability to function and their quality of life. 4 out of 10 patients indicate fatigue symptoms worse than the national average in cancer patients. Through some statistics, 4 out of 10 patients indicate fatigue symptoms worse than the national average, and 50% of patients reported they were moderately to severely concerned with sleep problems at some point. How cancer impacts sleep and fatigue in your cancer treatment, anemia, pain, emotions, lack of sleep, nutrition, medications, lack of exercise, and hormonal changes. Some tips can include self-care options. Coping with fatigue may require things you can do on your own. You might try to conserve your energy, which is to save your energy for your most important activities. Keep track of the times when you feel your best and plan to do your important activities during those times. Ask for help from loved ones or friends when needed. To maintain your energy, drink lots of fluids, and eating well can help restore your energy levels and keep your reserves up. Limit or avoid caffeine and alcohol. If nausea and vomiting make it hard to eat, talk to your doctor about those side effects, because there potentially is medicines that they can prescribe to help with those. Another tip is to get moving. When you feel up to it, light exercise throughout the week may help you preserve your energy levels. Exercise regularly as you start your treatment. You'll get in the routine of exercising, and it may even help you prevent fatigue during treatment. Relaxation techniques, breathing exercises, body scans, and medication can all help to relieve stress and boost your energy. And it's always important to keep track of how you're feeling and alert your team. How cancer impacts sleep with your mental health. It's estimated that up to 1/3 of people treated for cancer in hospitals have a common mental condition. These can include distress, depression, and anxiety. Insomnia and other sleep problems can impact emotional well-being and quality of life. Insomnia and other sleep problems can also increase the risk of developing depression. Depression and anxiety have shared symptoms like fatigue, lack of sleep, and decreased appetite, which can also make recognizing mental health conditions difficult, especially while you're going through cancer. Sleep disorders are frequently associated with psychological impact of cancer, as well as the physical illness itself, pain, hospitalization, and specific medical treatments. Altered sleep adversely affects emotional well-being and daytime performance, and may be an early sign of delirium in the oncology setting. "49% of respondents were at risk for clinically significant levels of anxiety, and 38% of respondents were at risk for clinically significant levels of depression." This data comes from a 2020 Cancer Experience Registry report. Some additional tips in terms of your mental health is addressing mental health changes. This can improve sleep quality and vice versa. It is important to talk to your healthcare team about any symptoms so they can direct you to the correct person who may help with them. And here is our writing exercise. So what I'd like you to do with the pen and paper that we asked you to grab at the beginning is to write down how cancer is impacting your sleep. And then what emotions and feelings does this workshop topic bring up? Also write down if you have any hope for improved sleep. And in a couple minutes, we can see if anyone is comfortable to share some thoughts on what this topic brings up for you. and we can discuss as a group. We'll just give you a couple minutes. Again, focusing on how cancer is impacting your sleep, what emotions and feelings this may bring up for you, and what hopes you have to improve your sleep. We will give just 2 more minutes. Is there anyone who would like to share?
Feel free to use the chat as well if you don't want to speak out loud.
Hi, I'll share. My name is Tammy. I'm finding that regardless of what time I go to bed, I'm waking up too early in the morning. Now, I recognize this is just part of my normal routine. Prior to cancer, I was an early riser. My body woke up early only because of years of working in the city, getting up and taking the train. Um, and I don't mind it, except that now the cancer is causing me to be so tired and so fatigued that I really wish my body would sleep in, and it just refuses to do so. I try not to nap during the day, but I do rest because I tire out very easily. And I just wish there was a way that my body would just, hey, can I at least sleep till 8 o'clock? And it just doesn't happen.
Yeah, that's very valid. That's very valid. You know, in terms of sleep hygiene, there's different things, and I'm sure you're doing a lot of these things already, but making sure that your routine is consistent, going to bed around the same time each night, it's really important to kind of keep that routine. Even on the weekends or a day that you want to sleep in a little bit later, you want to try to get up at the same time to keep that consistency for your body. Making sure that you had some time to wind down at the end of the night, giving yourself 30 to 60 minutes of no phones, no electronics, things like that, that can stimulate you, making it harder for you to fall asleep when it's time for you to fall asleep. Dimming your lights, kind of like that mood lighting piece, can be very helpful as well. and doing different relaxation techniques. If you are getting a good amount of sleep per night, whatever is typical of for you, 6 to 8 hours, I would say. Most people want to be within that range. Then getting up early is not necessarily about you're getting enough to give your body time to rest and recover, especially when you're going through treatment such as chemotherapy and you're on different medications that may make you very tired. The blue light from your phone is also very damaging in terms of getting yourself to sleep, which is why putting your cell phone down and having some non-phone time is important. The blue light can actually decrease your own ability to produce melatonin, which helps us go to sleep. Something that can be helpful as well, which I know is difficult for cancer patients in general because of, again, some medicines that you may be on or chemotherapy, but getting some daytime light exposure is very encouraging to then being able to sleep later at night. It actually helps in circadian rhythms and can encourage quality of sleep. So if you can get some sunlight, of course, being careful, making sure you're wearing sunscreen because suns can make you photosensitive. So being mindful of that as well. We don't want to keep ourselves away from the sun. Making sure we get some natural light is important as well.
I can share. Can everybody hear me?
Yes, can hear you.
Okay, I'm Liz, and I should preface this by saying that I've had anxiety my whole life, even long before cancer. But since I've had cancer, I was having some pretty severe problems with anxiety. Um, I've been in treatment for metastatic cancer now since about 2021, and I started having problems with insomnia, and then lately, I have to say, within the last couple of years, what seems to have become a pattern is that I don't have too much trouble falling asleep, um, but I wake up every morning without fail around two, quarter to three, around three, quarter to three, and with very high anxiety. A lot of it about total nonsense, and having come out of really high anxiety dreams. And I've done, I've done some reading on sleep hygiene. I get up, I go somewhere and read for about a half an hour, and I actually take medication to help me get sleepy again. In about a half an hour, when I start feeling sleepy, I will go back and I will fall asleep. But the remaining couple of hours that I sleep is still really fraught with anxiety. And then the whole morning is fraught with anxiety. And so I'm afraid I'm becoming over reliant on anti-anxiety medication. And I just don't know how to break this 3 a.m. cycle, which I understand is not uncommon, even with people without cancer. There's something about the 3 a.m. hour when the demons come out.
Yeah, I have heard throughout my career people waking up in the middle of the night and having difficulty going back to sleep, and that is even without cancer on the table as well. So yes, you are correct about that. I think there's a couple different things. So, are you on the right medicines? There's a lot of different types of sleep medicines and anxiety medicines, and not all of them are created equal. So that's something that you may want to look at with your providers, making sure that there's no dependency. So for example, benzodiazepines, which would be Xanax, Ativan, things like that. Those are really, really great medicines for acute anxiety, such as panic attacks and things of that nature. However, they're only intended to be used for short periods of time, and they can create dependence. And there's something that we say in psychiatry, which is that nothing quite works like a benzo. So if you have taken a benzodiazepine, you know that it's very effective for acute anxiety. And when people start to feel anxious, and not at the acute level yet, but when they start to feel anxious, they sometimes go to use those medicines so that they don't go into the full-blown anxiety episode, if you will. And it ultimately loses effect to work in those acute episodes, because people are using them when they're not in those acute episodes yet, fearing that they will get there and trying to pre-medicate it sometimes. And so that's just an example of a type of medicine that we use. There's other as needed medicines that are not in that class that can be helpful. Some of those are hydroxyzine, propranolol, gabapentin, all sorts of different classes of medicines that can be used that are non in that benzo family. And then looking at, are you on a day-to-day anti-anxiety medicine? An SSRI, an SNRI, so people with generalized anxiety disorder, having something that you have for your baseline anxiety will reduce overall anxiety potentially if you find the right medicine combination. But in addition to that, having therapy. So the treatment of choice with anxiety as well as insomnia is CBT, or cognitive behavioral therapy, and different therapeutic techniques. So making sure you have the other side of it versus just medication to help you formulate some of those coping skills and look at if there's anything else going on that's causing you some sleep disturbance.
Okay. Thank you.
You're welcome.
Did you put me on?
I don't know if somebody else is anticipating going next.
Yeah, I'm ready to go. It's Jim. Is
Hi,
it
Jim.
on there? Hi, I've been having real problems with I'll get up in the morning and if I lay back down or sit down and I fall asleep, I'm not getting back up for a while. And that's been an issue. And I think the biggest problem that I was having was that I used to exercise quite a bit between weightlifting and some bicycle riding. Nothing heavy, just like, because the doctors had suggested to me that if I could do that at the same time every day, it would help get me in a better rhythm for sleeping. I'm not sure how you feel about that. And I do get anxiety and I worry about what's going to happen.
So I would really try to avoid laying back down once you're up in the morning.
Okay.
And try to do your physical activity earlier in the day as opposed to later. So
Okay.
if you work out later in the evening, that can actually worsen your ability to sleep overnight,
Okay.
causing you to be more tired in the morning. So if you kind of, get up and you can avoid laying back down and doing your physical activity, then try to get on that schedule over time.
Okay.
Hopefully you can get on that routine. But laying back down is often a very big struggle for people because you are so tired. So you really need to try to push through any way you can. Change the scenery, go outside, have something to eat, a snack. If it's breakfast time, have breakfast. Something light, not too heavy to where, again, it's contributing to your fatigue and maybe makes you more tired and want to lay back down.
Yeah. You mentioned fatigue, and that was one of the things. I get cold. I get chills. Just it's like crazy. I mean, I gotta watch a little TV and have blankets on me.
Yeah.
I get that cold. And I'm not sure what is causing it or where it's coming from.
Have you mentioned that to your care team? It could be a side effect of medicine that you're taking.
Okay. I'll bring it up again.
Yeah, especially if I had mentioned anemia. One of the biggest things with anemia is feeling very cold, especially if you're iron deficient. So just making sure that if there is anything that your care team can do to help you on that side of things, that they're aware that you're experiencing that, and then they can look a little bit more closely to see if maybe you are having some anemia or something like that.
Yeah, I've been very lucky because my wife is a nurse and she's been able to head a lot of this stuff off and help me. But she's the one that brought this talk to me today because it's just a matter of the chills, the getting up and staying up, um, and the anxiety and the worry. It's like it's all one big lump that's there
They
now.
all can contribute to the other. Absolutely.
Okay.
Yep, they all can. And I think sometimes we just need to meet ourselves where we're at. So if you're cold all the time, maybe check your thermostat and see where it's at. If you're keeping it a little too cool in your house, maybe raise it up a little bit. Obviously keeping in mind the other people in your home, making sure that everyone is comfortable. But wearing extra layers and things, just trying to make yourself a little bit more comfortable.
Hmm.
Being too cold can make you sleepy. Also, being too hot can do things too. So, just trying to find that balance. And if you are cold, again, that exercise, kind of moving, can help raise your temperature a little bit if you are
Okay, that's a good
feeling that way.
suggestion. Yeah,
Yeah.
yeah, great. And and then I did the exercise thing like consistently for 3 to 4 days, and I was really shocked at how well I did then. That I was able to move ahead a little bit, but it seems like I may have fallen back into it a little bit.
That's okay. It's baby steps, really. So you start out small and then you push yourself a little bit each day. So, for example, if you go for a walk for 10 minutes, the next day try 11 minutes. The next day after that, try
Okay.
12 minutes. So, a lot of times people have a hard time comparing their former abilities before cancer and expecting you to lift as heavy or walk as far or run as far or do things in the same way. But sometimes it changes, and we just have to be mindful of that and be aware
Hmm.
that listen to your body. Your body will kind of guide you of what it's able to do and handle. So start small and then work your way up from there, because stamina
Okay.
increase over time.
Okay, but you say the doctors do have a medicine that will help you with the chills?
So they would need to check your labs.
Okay.
So I think you just need to mention that to your care team, and they can see if maybe it's a side effect of medicine that you're currently on.
All right.
If not, they might want to do some lab work to see if you have, something else going on
There's
that
something
could be
else
a
going on. Yeah.
contributor. Yep.
All right.
And then
Great.
depending what they find, there could be medicine that could help it if they have discovered something.
Okay. Thank you very much.
You're welcome.
It was very good.
All right. I actually have something a little bit different I'd like to ask about. I awaken after about 10 hours of sleep, tired, and I will get up, make breakfast. I'll get up at 8, make breakfast, eat breakfast, and by 10 o'clock, I need a nap. I will fall asleep. And I will say it's improving right now, so I don't want to delve too far into it, but if anybody else experienced that, and I can fall asleep on the couch. Well, I haven't done it standing up, but I've been seated at the computer and mid-sentence, I'll fall asleep. I'll wake up with my head on the desk, and get up and go to bed and sleep 10 hours. So sleep doesn't impact my sleep,
Sure.
but
So it really sounds like classic fatigue. Fatigue is when you're so tired and sleep does not help it. You don't feel any more rested that you're getting sleep. So the importance of sleep, the reason that we sleep is that is the time that your body is healing. So the fact that you're sleeping is good because it's promoting healing from within, but you're still feeling rested, likely due to fatigue. And, without getting too deep into your specific treatment, but it may be directly related to what medicine or treatment you are currently under. And, in time, it improves. And as medicines changes and always make sure that you're going back and telling your care team, because sometimes I've seen the oncologists here at Bay Health, they will dose reduce in sometimes for people with chemotherapy to help certain side effects. And I'm not saying that I'm not an oncologist, so I cannot advise that
No,
people
I
should have
understand.
dose reductions, but making sure that you're communicating that, because quality of life overall is very important. And if your functioning level, but then also on the other side of it, is it fatigue would be a question, or is it possibly depression? And maybe there's some untreated mental health issue going on that may need a different type of treatment, such as seeing a psychiatric nurse practitioner, psychiatrist, or a counselor of some kind to help on the other side of things. And so sometimes it's trying to differentiate between, there's so many overlapping symptoms, and it's really trying to figure out what's going on with you and get you the best treatment that you need in all aspects of it.
Thank you.
You're welcome.
I had a similar situation, but it was well before I got cancer, and I was sleeping 10 hours and not feeling rested. And it turned out I had sleep apnea. It wasn't the snoring as much as my oxygen levels dropped. And once I got a CPAP machine, I
World
woke
of a
up
difference.
and I was rested. It was amazing.
Mm-hmm. Yeah. So we always want to rule out any kind of physical issue that may be happening. And that's why it's so important to talk to your care team, whether it be oncology, your primary care doctor. And when you try different things and different things may not work, that's kind of what leads us to explore a little bit more. And so, not all times do we have a definitive answer of something like that, where you have an untreated medical condition and with treatment, it gets better. But sometimes it takes a little bit more time. And I just encourage you to be open and honest with your care team, letting them know what you're experiencing so that they can help figure that out with you, and try to get the most improvement that you possibly can get.
I have a quick thing. My name is Cindy, and I have a lot of trouble with getting comfortable. I have loads of neck and back issues. So what ends up happening with me, I'm tossing and turning. I can't shut off my mind. And then I'll get up several times to get an ice pack or to turn on a heating pad. And so I find that I'm having really little to no sleep. And then, of course, I'm in the factor of trying to keep hydrated. And so I also will get up to go to the bathroom multiple times. So I definitely need help on how to shut off my mind, and then getting myself comfortable in a quicker process and not constantly having to, or thinking that I have to get up to do something to fix with the pain without trying to take medication.
Mm-hmm.
So I'm curious what your thoughts are on that.
Yeah. Well, the phrase of "I can't turn my mind off" is a classic kind of symptom of anxiety. So obviously I don't know if you're experiencing anxiety, but it would be something that I think you should maybe look into as to a potential reason. Because if you do have underlying anxiety and you get on a treatment for that, that could help contribute to better sleep, being able to turn that off. Hydration, we talked about that, is very important. But if it's keeping you up and you're getting up every couple of hours to use the bathroom because you're drinking late in the evening, what we usually recommend is trying to drink most of your fluids earlier in the day and kind of slowing it down as you're getting closer to bedtime. So within like an hour or two of bed, you want to maybe slow down what you're drinking so that it doesn't disrupt that. And then focusing on those sleep hygiene measures that we had talked about, limiting caffeine and alcohol, trying to do some exercise, the light exposure, keeping your room comfortable, dark, cool, to promote sleep. And then restrict the in-bed activity, which a lot of people do because, you know, when you're not feeling well and you're feeling so tired, you're laying down a lot, but that actually worsens your ability to sleep at night a lot of times, is that kind of sedentary type of activity. So changing, you know, we really try to focus on keeping the bedroom just for nighttime sleeping. So not to hang out in there, don't lay and watch TV. Of course, you know, keep in mind your pain and what is going on with you. So also, is your pain managed appropriately? Talking to your providers about pain management, maybe they can have some recommendations that can help in that way. And again, keeping that open communication so that each thing is kind of investigated, if you will, and hopefully can contribute to an overall better night's sleep and rest for you.
I have a question. Thank you. Do you recommend like doing sleep meditations through like an app like Insight Timer or like white noise or anything to that nature?
White noise is very helpful. I use white noise in my home. So everyone is different. I would say find what works for you and what relaxes you and use that. It may be some trial and error, you know, maybe white noise is not the frequency for you. They also have pink noise and brown noise and all sorts of different kind of frequencies, nature sounds and things. You don't want it to be overstimulating. You want it to be relaxing. So if something is kind of stimulating and getting you going a little bit, you want to avoid that one and really focus on something that can be helpful.
Okay. Thank you.
You're welcome.
All right, thanks for all the great things you guys shared. I want to let Stacy go ahead and get through our slides. There is a little time for questions at the end. I want to make sure we get there. So thank
Okay, so the importance of sleep and how cancer impacts sleep. The goal is to optimize your sleep practices. So health practices on the next slide. Health practices and environmental factors essentially equal sleep hygiene. Changing health practices and changing environmental factors leads to improved sleep hygiene. And then there are some ways that we can optimize your sleep practices. You want to go to the next slide? So set up your sleep schedule, follow a nightly routine, cultivate healthy habits, and improve your bedroom. In terms of setting up your sleep schedule, try to have a fixed wake-up time. Regardless of whether it's a weekday or a weekend, try to wake up at the same time, since a fluctuating schedule keeps you from getting into a rhythm of consistent sleep. Prioritize your sleep. It might be tempting to skip sleep in order to work, study, socialize, or exercise, but it's vital to treat sleep as a priority. Calculate a target bedtime based on your fixed wake-up time and do your best to be ready for bed around that time each night. Make gradual adjustments. If you want to shift your sleep times, don't try to do it all in one full swoop because that can throw your schedule out of whack. Instead, make small step-by-step adjustments of up to an hour or two so that you can get adjusted and settle into your new schedule. And then reduce napping during the day. We do not want you to overdo it with naps because naps can be a handy way to regain energy during the day, but they can also throw off your sleep at night. To avoid this, try to keep naps relatively short and limited to the early afternoon. If you sleep too late in the afternoon, it will affect your ability to fall asleep at night. Follow a nightly routine. How you prepare for bed can determine how easily you'll be able to fall asleep. A pre-sleep playbook, including some of these tips, can put you at ease and make it easier to get to fall asleep when you want to. Keep your routine consistent, following the same steps each night, including putting your pajamas and brushing your teeth can reinforce your mind that it's bedtime. So keeping those things in order, like the first thing you do is wash your face, then brush your teeth, then put your pajamas on, then use the bathroom and have one last drink. Make a routine and try to keep it as consistent as possible. You want to budget time for winding down. Budget 30 to 60 minutes to your wind down time. Take advantage of whatever puts you in a state of calm, such as soft music, light stretching, reading, and/or relaxation techniques. Dim your lights. Try to keep away from bright lights because they can hinder the production of melatonin, a hormone that the body creates to facilitate sleep. Unplug from electronics. Build in a 30 to 60 minute pre-bed buffer time that is device free. Cell phones, tablets, laptops, they all cause mental stimulation that is hard to shut off and also generate blue light that may decrease melatonin production. And get up and try again. It helps to have a healthy mental connection between being in bed and actually being asleep. For that reason, if after 20 minutes you haven't gotten to sleep, get up and stretch, read, or do something else calming in a low light before attempting to fall asleep again. And if you're experiencing pain and a prescribed pain medication, make sure you take that 30 minutes or so before bed so that it is working and you're not in acute pain when trying to go to sleep. We want to cultivate healthy habits. Whoop, that's okay. It's not just bedtime habits that play a part in getting good sleep. Incorporating positive routines during the day can help support your circadian rhythm and limit sleep disruptions. So don't overdo it with naps. Naps can be handy, as we talked about, but they can throw off your sleep at night. We want you to go to bed when you're sleepy. Stay physically active. Regular exercise can make it easier to sleep at night and also deliver a host of other health benefits. Having a routine during the day can help with creating a normal wake-sleep cycle. Reduce caffeine and alcohol consumption. Alcohol may make it easier to fall asleep, but the effect wears off, which disrupts sleep later in the night. As a result, it is best to moderate alcohol consumption and avoid it later in the evening. Because it's a stimulant, caffeine can keep you wired even when you want to rest. So try to avoid it later in the day. Also be aware if you're consuming a lot of caffeine to try to make up for lack of sleep. Reduce eating and drinking before bed. Eating dinner late, especially if it's a big, heavy, or spicy meal, can mean you're still digesting when it's time for bed. In general, any food or snacks before bed should be on the lighter side. Reducing eating and drinking before bed can also help reduce the need to wake up during the night to use the bathroom. And then we want to restrict in-bed activity. To build a link in your mind between sleep and being in bed, it is best to only use your bed for sleep, with sex being the one exception. Improve your bedroom. Make sure your space is comfortable and fit for sleep. Close your blinds, make sure your bed and bedclothes are comfortable, make sure distractions are at a minimum. And then this is a mindfulness exercise. So we're going to do this for a couple of minutes. And so what I want you to do is find a position in which your body is comfortable. Once you're there, you can close your eyes gently or look down at the floor, whatever you feel you need to do to be comfortable. Now take a few easy, slow breaths, with each trying to release any tension you notice in your body. As you're doing this, begin to notice your breath. Feel your stomach rise as you breathe in and lower as you breathe out. Notice the rhythm of your breath. Sometimes it can be very relaxing. After your inhale, you hold in for 4 seconds and then exhale for 4 seconds. We actually call this box breathing in the mental health world. So you inhale for 4 seconds, hold for 4 seconds, exhale for 4 seconds. As you get into that rhythm, The exhale, you want to focus on that, making that longer if you can. It's only natural that your mind may wander. As it does, remind yourself to focus on your breath. Stay here in this moment. Continue to breathe gently, connecting with your breath. Allow yourself to feel whatever you are feeling and be present with your current experience. Take a couple more breaths. I'm going to inhale in for 4 seconds, then hold for 4 seconds, and slowly exhale out of your mouth for 4 seconds or longer. You can go to the next slide. So again, the importance of sleep, how cancer impacts your sleep. We want you to optimize your sleep practices and talk to your healthcare team. 44% of cancer patients reported a sleep problem in the previous month, but only approximately 17% communicated that problem to their doctors. So here are some things that you can ask. These are questions you can ask your doctor or nurse if you're having trouble with sleeping. The first step is to tell someone that you're having problems, so then you can learn about potential ways to fix it. So you can ask, why am I having trouble sleeping? What steps can I take to sleep better? Would you recommend a sleep therapist who can help me with the problems that I'm having? Would sleep medicine be advised for me? Some different help for sleep issues. Relaxation therapy can be learned with a professional and then incorporated in your own routine, such as breathing techniques. Sleep aids are very common for cancer patients and may also help with other issues like pain or appetite. Treating insomnia in cancer patients with a combination of pharmacologic and non-pharmacologic therapy may have a positive impact not only on the insomnia itself, but also on related symptoms, including pain, fatigue, and psychological distress. It's important to address other issues that are causing poor sleep, like physical discomfort, in order to tackle the problem at the root cause. And I think that brings us to the end.
Yeah, so thank you, Stacy. We're going to have a chance if anyone else has any other questions or something they want to ask about. I will mention, I will include in the email with the recording and the presentation slides a list of just some apps that can be helpful with doing meditation similar to the one Stacy just did. There's also some things out there for falling asleep that are like people reading stories or talking, that for some people find those very helpful. So we can include some of those suggestions as well as resources. So I'll include that, but I'll open it up if anyone has any last minute kind of questions or things maybe she didn't touch on or that she did, you want to know a little more about. And while we're waiting, I will say that's my contact information that you see on the screen. And feel free to, if you think of a question after the presentation is over, reach out to me. I can, if I don't have the answer, I will contact Stacy to get the answer and we'll figure it out for you. So don't feel like this is the only time to ask questions.
I just wanted to say thank you. You know, I come to these, I think I've been to 3 different things on sleep, and there's always something that I pick up that's different. So I appreciate it.
Very welcome.
Yes,
Welcome,
I
Kathleen.
agree. Thank you so much.
Very welcome. Thank you guys for all joining.
All right, so I think we'll end here. If you have questions, you could send them to me. And the storm just started here in Wilmington, so if you're out and about, just be safe. And Stacy, thank you for joining us. We are going to invite her to come back again and talk a little more about a different topic that she's familiar with, and medications for mental health. So, little spoiler alert, that's coming. But
Great.
thank you all for being here, and
Yeah.
thank you, Stacy.
You're very welcome. Thank you for having me. Everyone have a good night, okay?
Thank you.
Take care.
Thank you so much.
Good night.
Bye.